Are you a first-year dental student learning dental anatomy for the first time, and all those new terms are starting to feel like a foreign language to you? Don't worry, we're going to clear up that confusion and get you prepared for your exams. Today I'll be sharing the basic dental terminology you need to know as a first-year dental student in order to classify and name teeth, so that by the end of this video you can take a set of teeth, a single tooth from it, and be able to name it based on the type of dentition it's from, the type of tooth it is, and where it's located in the mouth. Hi, I'm Dr. Clara. I'm your new dental study coach, and I'm taking mountains of textbooks and information and turning them into short, digestible videos for dental students. I'm excited to be on this journey with you through dental school, and I hope to make that adventure just a little bit easier. Let's get started with some basics. So the first group of basic dental terms you need to know in order to classify a tooth are the different types of dentition. And dentition is basically just a full set of teeth in the mouth. As humans, we have two sets of teeth. The first set are our primary teeth, also called baby teeth, milk teeth, or deciduous teeth. These are the teeth that we get as a young child, and typically we have all of them in our mouth by the age of 2 or 3. There are 20 in total, and we eventually lose them. So the second set of teeth are the permanent teeth, or the secondary teeth. These are the teeth that we aren't technically supposed to be losing at any point. We're supposed to keep them permanently. There are 32 in total. With humans having these two sets of teeth, there's another term you should know. That term is diphyodont. Humans are diphyodont, which means we get two sets of teeth. Di, two, odont, teeth. We have two successive sets of teeth. Do you know who else gets two sets of teeth? Cats. Hi.
Look at those teeth. Yeah.
If an animal like a mouse only has one set of teeth for their whole life, they are monophyodont. And if an animal has multiple sets of teeth and they're just constantly losing teeth and replacing those teeth, they are polyphyodont. And that would be a shark. And let's keep that shark here for a few more moments for another term. A shark has multiple teeth that are the same. So in addition to be polyphyodont, they are homodont. Unlike humans, you and me, who have different teeth. Our teeth look all different. There's different types of them. So we are heterodont. And this brings me to our second set of terms that you as a first-year dental student need to know in order to classify teeth. And these are the different types of teeth. As humans, you and I have 4 different types of teeth. Now let's start by looking at the adult teeth. Starting at the midline, we have the incisors. Incisors have flat edges, flat incisal edges. Their function is to bite food. There are 8 incisors in total, 4 on top, 4 on the bottom. And there are 2 types. The incisor closest to the midline is the central incisor, and then the incisor second from the midline is the lateral incisor. The second type of tooth you should know, and the third tooth away from the midline, are the canines. These teeth are not flat like the incisors. They're much sharper. They come to a point. They have a cusp. The function of the canine is to tear and rip food. There are 4 canines total, 2 on the top and 2 on the bottom. Another term that you might end up hearing for canines is cuspid, meaning it has a cusp, or you may even hear patients call them fang teeth or vampire teeth. The third type of tooth you need to know are the premolars. The premolars have multiple cusps, multiple sharp tips to them. They have 2 or 3 of these sharp cusps. Their function is to tear, grind, and crush food, basically chew the food. There are 8 premolars total, 4 on the top and 4 on the bottom. There are 2 types of premolars. There's a premolar 4th from the midline and 5th from the midline, and that is the first premolar and second premolar, respectively. Premolars are sometimes called bicuspids, which is actually incorrect. Bicuspids means having 2 cusps, but there is a premolar that has 3 cusps to it. The last type of tooth you need to know are the molars. These teeth are the farthest away from the midline. These are the largest teeth in the mouth, and they have multiple cusps. Some have 4 and some have 5. The function of the molars is to crush and grind and chew our food. There are 3 types: the first molar, the second molar, and the third molar, which are the 6th, 7th, and 8th tooth away from the midline. Another name for the third molar are the wisdom teeth. Primary teeth, unlike permanent teeth, only have 3 types of teeth. There are no premolars in the primary dentition. So starting from the midline, we have the incisors with those flat edges, 2 types, the central incisor and the lateral incisor. Then we have the canines. There's only 1 type, so it's just the canine. And then with the primary teeth not having any premolars, we go straight to the molars. And unlike the permanent teeth, there's only 2, not 3. So there's the first molar and the second molar. And this brings us to our last set of dental terminology you need to know as a first-year dental student to classify teeth. And it's to classify teeth based on the location in the mouth. The teeth in the mouth can be divided into the top half and the bottom half. The teeth that sit in the maxilla, or the upper jaw, are the maxillary teeth. And the teeth that sit in the lower half of the mouth, or the lower jaw, or the mandible, are the mandibular teeth. The teeth sitting in the jaws, if you actually look at them from the chewing side, are arranged in an arch. So oftentimes looking at just a set of teeth, it's just called the arch. This is the maxillary arch and the mandibular arch. In a full set of permanent teeth, there are 16 teeth in the maxillary arch and 16 teeth in the mandibular arch. In a full set of primary teeth, there are 10 teeth in the maxillary arch and 10 teeth in the mandibular arch. The teeth in the mouth can be further divided into quadrants by taking a line and dividing the mouth in half, into the left and right half. And by left and right half, I don't mean your left and right half. It's actually the patient's left and right half. So this is the patient's right, so this is the right half of the patient. And this is the patient's left, so this is the left half of the teeth. Dividing the mouth this way, with a maxillary, mandibular, left and right, we get 4 quadrants: the upper left, the upper right, the lower left, and the lower right. In a full set of permanent dentition, there are 8 teeth in each quadrant. In a full set of primary dentition, there are 5 teeth in each quadrant. Teeth can also be divided into front teeth and back teeth, anterior teeth and posterior teeth. Anterior teeth are the teeth in the front, closest to the midline, and posterior teeth are the teeth in the back, farthest from the midline. The incisors and the canines are the anterior teeth, while the premolars and molars are the posterior teeth. So now if you are given a full set of teeth and one tooth is highlighted, you can name it. So you're going to name it first by the type of dentition, which arch it's in, which half or quadrant it's in, and then the type and class of tooth it is. So let's take this one. So which dentition is it in? Permanent dentition. Which arch is it in? The maxillary arch. Which quadrant is it in? The left. And which type and class of tooth is it? It's the lateral incisor. So we have the permanent, maxillary, left, lateral incisor. Let's do another one. So which tooth is this one? Primary, mandibular, left, first molar. Awesome, congratulations. Look at you go. So now you can name literally any tooth in the primary or permanent dentition of a human. Ha! Awesome. However, this is not the most efficient way of communicating which tooth you're looking at. As a dentist, you're going to be writing notes on what you did with teeth that day. You're going to be writing referrals to specialists. And if you're talking about multiple teeth, it's going to get very, very lengthy to have to say 5 words for each tooth you're trying to talk about. So in dentistry, there's actually shorthand notation in order to classify a tooth, in order to name a tooth, in order to communicate what tooth you're talking about. And that's my next video. So stay tuned. Subscribe so you don't miss it. If this video was helpful, please let me know and give it a like. Otherwise, I'll see you next time. Happy studying.